Yeah, I'm just going live right now. So I'm just here answering a couple questions, my weekly question and answer session on sports medicine injuries. And I am here to answer any questions you have about the sports injuries of shoulder, hip, and knee. Today, I was in the operating room today and did a case working on a shoulder and fixed up someone's shoulder. So I'm just going to get started in a few minutes. Thanks everybody for joining already. My name is Dr. Phil Williams. I'm an orthopedic sports surgeon focusing on shoulder, hip, and knee injuries. And I do sports medicine. And I do this session about once a week, every once to give folks a chance to ask any questions about injuries and sports medicine in general. And I try to answer as many questions as possible. If I don't get to your question, you're welcome to send me a DM or a comment to have me answer your question at a later point when I can. So we're about to get started, and thanks for joining already. And again, we'll get started on some questions, and let me just get started right off the bat. Tanner says, when can I golf after a Bankart repair? So Bankart repair is a repair of the shoulder labrum, usually is as a result of a dislocation to the shoulder. And typically, Bankart repairs, patients do well with physical therapy. And I usually am confident in releasing them to sports if they have good range of motion and strength by about 4 to 5 months. So I'm going to go with a couple other questions. So, again, I'm a shoulder, hip, and knee doctor. So I'm going to try to keep these questions specifically tailored to those areas of the body. So if you ask questions about other parts of the body, I might not get to them. So Kiki says, I've had 2 ACL repairs done. Do you think I can still commit to D1 soccer? So that's a great question. And specifically for soccer and specifically for females, there is a higher incidence of ACL tears in that population, specifically for for a lot of different reasons, mostly because there's some anatomic differences in women in terms of how they land and how they pivot, which may increase their susceptibility to ACL tears. But for someone who's had multiple ACL tears, as long as they've had the correct recovery and rehabilitation process, I would imagine you should be well rehabilitated and be able to play soccer at a high level. You just have to make sure that you are stable in terms of everything you do and have had a good return to sport and you feel confident in your knee, because confidence and the mental component itself is very important when you go back to your sport. Um, so going to skip around here to some questions that came up. Um, so Jeff says, why is bursitis more common with aging? With aging, so bursitis is irritation and inflammation around tendons, and it can be very painful. It is not necessarily common with aging, but it is more common when people have a lot of inflammation, which may be related to the aging process. So I think the bursitis is more of a indication that there's more inflammation in the body. Olivia says, I've had 6 shoulder surgeries for posterior instability. Nothing is working. What do I recommend? So that sounds like a very difficult situation. Sorry for your shoulder issues. A posterior instability problem that is not getting better with multiple surgeries, in general, I would say probably needs to be looked at differently in terms of maybe a different workup, because it might be possible that there's another issue that's not being addressed. There might be differences in the bone that have an anatomic issue that causes the persistent instability. So I can't obviously recommend something over the internet in terms of what to do for your shoulder, but I would seek the advice of a very competent shoulder and elbow surgeon who specializes in these conditions, and that you might find a different answer than what you've been getting. Uh, So I tore my labrum when I dislocated my shoulder, and now it pops out in the ocean a lot of years later. Thanks for your question. So tearing your labrum is part of the process when you dislocate your shoulder, usually because that is one of the stabilizing structures of the shoulder. If you have dislocation events that occur more easily with low level and low traumatic episodes, usually you need to get that fixed with surgery if you fail physical therapy. So I'm going to skip around here. Um, so Lincoln Kuntz says, I had meniscus surgery and they cut out 30% of my meniscus. Will I be back to what I used to be? Meniscus surgery is important to help in shoulder pain, and meniscus surgery can be helpful for knee pain. So the meniscus is a shock absorber in the knee, and you can either take out the meniscus that's torn or you can repair it. If you have to remove it, that means that the meniscus in most cases cannot be repaired, meaning you can't stitch it together. And you want to keep as much meniscus as possible because that's your shock absorber in your knee. So if you have meniscus that's removed, it's possible that you might have pain or arthritis in the future, but usually your pain is well improved after a meniscus surgery that takes them out. So it kind of depends on where the tear is and how significant you feel afterwards. But usually patients do well after a meniscus repair or meniscus surgery. So I have a question here. It says, can a shoulder labrum tissue heal if it's torn or similar tendons that is not healing? So I think the question is, can a shoulder labrum heal or other tendons heal? So the labrum, once it's torn, cannot heal. So the labrum is like a rubber gasket or a bumper that goes around a joint, specifically in the shoulder and the hip. And once it's torn, it cannot heal. So those are tissues that do not have the ability to heal once there is any kind of injury. So that's why many of these structures need surgery once those injuries occur. So Ghost Trial 10 says, can I make a full recovery from a dislocated left patella? Many people do well after dislocated patella because they do physical therapy. And for some people, I would say the vast majority, they do not have recurrence of the dislocation. However, some people do have recurrence of dislocations in their patella once they have it. And those are the people that, if they have multiple dislocations that cause pain and disability in terms of playing sports or just kind of living day to day, those are the ones that need knee surgery to fix their issue. So I'm going to skip around here. Anjali says, I have an OCD lesion in my right ankle. Can get an MRI, but I really don't want surgery. How do I heal? So an OCD lesion stands for osteochondral defect. And these defects can happen in any joint, usually happens in the shoulder, usually happens in the elbow, and the knee and the ankle for the most part. Other joints can be affected. But in general, we try to treat these lesions with physical therapy if you don't have significant symptoms or if it is not terribly big. The bigger they get, the harder it is to treat without surgery. So it all depends on the size of it and the symptoms of the OCD lesion. Because these lesions do not heal on their own, it is important to have it addressed appropriately if it is symptomatic. So a question here is, Sophie says, what should I do for labrum microtear? I'm guessing that you mean a small tear in the labrum. And again, labrum tears do not heal on their own. They can improve with physical therapy because physical therapy usually aims at focusing on the muscles that surround the joint to take off the stress from that injury. So it depends on the symptoms and depends on how the response from physical therapy was. Again, if I miss your question, just send me a DM. I'll try to get to it as soon as I can. Unfortunately, I don't have a lot of time right now. I just kind of came on quickly and I have like 5 minutes left. Um, so Jack says, I had ACL meniscus surgery about a month ago. How do I know that everything is still together? It is very rare for patients to re-tear their ACL in physical therapy. Physical therapy is very well controlled and it is very progressive. And so, unless there's some big traumatic episode or some big new injury during the early postoperative phase, it is very rare to just re tear your ligament reconstruction in physical therapy or everyday activities. So, I have not seen it ever. And I'm sure it can happen, but it's just very rare for it to happen. So Bowman Hiller says, is there any hope for chondromalacia at 26 years old? So chondromalacia is a term we give a joint that has damage to it. So it's a very generalized term, and it just means that the cartilage or the chondral surface has injuries to it and is not as smooth as it can be. And for chondromalacia, there is no reversal of that process. Once the cartilage has injury to it, it does not reverse. And so the best things that we do and we recommend for chondromalacia is one, to try to limit any significant weight to that. So that could be just losing weight if you're overweight and focusing on activities that strengthen the joint involved. So if it's a knee chondromalacia, work on strengthening the knee to take stress off of the knee specifically. But there is no real solution for chondromalacia other than limiting the progression of the injury and hoping it does not turn into full-fledged arthritis, which is what the next step of chondromalacia is. So unfortunately, I have about 2 minutes left that I can answer like one or two more questions. And then if I don't get to, send me a DM. User says, what are my thoughts on PRP to treat a labrum tear? So PRP is platelet-rich plasma. It's your own blood that is spinned down, and we take the platelets from that, which has some growth factors, which heals or which helps with pain primarily. So we're talking about pain for the most part. There is no real definitive evidence that PRP actually heals any labrum or tendon. It can help with the pain process. Some of the PRPs that we use is helpful in treating pain related to arthritis in the joint. So that is a pain relief standpoint, but there is no evidence that a PRP shot can actually heal it. It might help with the pain associated with it. So I have to do one more question. Again, if I missed your question, please send me a DM. So Philmon G says, I have an osteochondral lesion on my right knee and a discoid patella. What can I do? So first of all, the osteochondral lesion, again, that's an OCD lesion, meaning there is a defect or an injury to the cartilage in the knee, and it affects the bone and the cartilage of the knee. So it is relatively deep. I'm not sure what you mean by discoid patella. That's not a term that we use. So that might, I think you might be referring to the location of the patella. But in general, the osteochondral lesion is a problem that can be fixed with surgery if it is big enough or it is symptomatic enough. And usually what I do for these cartilage lesions is actually to do a transplant of cartilage for the cartilage lesion. So that's taking a piece of cartilage from one part of your knee that is not necessarily weight bearing and placing that area of cartilage onto the defect that is injured. So it's called an osteochondral transplant. And if it is big, like a big lesion, you can do a donated chondral transplant where you take a cadaver or someone who has, oh, that's my time to go. If someone has a knee that, or a donated cadaver that has a big lesion, you take that big cartilage disc, basically, you cut out a big area and transplant that cartilage into the defect lesion. And so I'm sorry, this is very quick and I did not answer most of these questions. I apologize for anything I missed. If you have any burning questions that I didn't get to, please send me a DM. And again, I appreciate you guys joining me for this quick little question and answer session. And I try to do these every week. So tune in next week if I did not get to your question, or send me a DM. Thanks, everybody. Bye. Any treatments for glenoid chondropathology? There is not. There are not. Thank you for your question. There is no real. Um, so sorry. There's a question about glenoid treatments for chondropathology and thinning. There are most of the treatments for glenoid injuries are more um, related to microfracture and basically trying to get the body to make new cartilage by accessing the bone marrow. But it is not a very common procedure. And the benefit of cartilage issues in the shoulder is that because we don't weight bear on the shoulder, usually they are more tolerated. But the end the end treatment for any cartilage problem in the shoulder is a shoulder replacement if it gets severe. So thank you for your question, and I have to go now. Thanks for joining. Sorry if you have any more questions, send me a comment or send me a note somehow or a comment on my page. Appreciate it. Thanks for tuning in.